As a departmental simulation officer, I'm responsible for being the director of a simulation team that puts together simulation activities for our interdisciplinary group, meaning that I coordinate crisis training for our OB providers, our midwives, our nursing staff, our nurse anesthetists, and to coordinate working together to be able to deliver care, manage crisis, and be able to deliver the best possible care for our patients. During this COVID period, we had to shift our simulation work to not only be focusing on the management of the crisis that could be occurring, but also how to do that while both keeping the patients safe from infection, keeping our staff safe from infection, and that took some practice. One of the unique opportunities in simulation is to be able to practice in a kind of lower risk setting, managing some challenging coordinated team efforts. For example, doing a cesarean delivery is something that we can practice doing all the time, but one thing that we hadn't yet had a chance to practice is doing that with personal protective equipment on. So that doing those things can help us understand where should we keep our personal protective equipment? What things do we need that might be in the way or obstruct our ability to move or get in out of the operating room? So it was a unique challenge and something that our team came together to be able to do. I think simulation is a lot about teamwork, and we're trying to build the safest possible atmosphere that we can. And safety is really built around culture, and so the continued working together, practicing communication, practicing management builds a culture of safety, and it's that culture that actually helps affect patient care so positively. Simulation work has been done in a lot of different fields, and it's been done in a lot of different fields in medicine. One of the unique things about our floor is that we are taking many different groups and putting them together, from anesthesiologists, OB doctors, high-risk obstetric doctors, our nursing staff, our midwives, bringing all of those teams together to manage what's really more than one unit. We have an emergency room area, an area of critical care, an area of recovery and post-operative recovery, and our own operating rooms all on one unit. And so our ability to be able to coordinate within that space is based on our ability to work and communicate well together. That's where simulation comes in to help advance what we can do to make that as smooth as possible.